Hello, today is the day 129 of 365 days project and I am here to continue the stroke. Let's see the causes of the stroke. The cause of the stroke depends on the type of stroke. It's mainly three types: transient ischemic attack, ischemic stroke or hemorrhagic stroke. Let's see the risk factors for stroke. Certain conditions which are more likely to have a stroke. These includes diet. An unhealthy diet that increases your risk of stroke is high on the salt, saturated fats, trans fats, and cholesterol. Inactivity or lack of exercise. Alcohol consumption, tobacco uses, personal background, which is family history, sex, age, race and ethnicity, and health history. Certain medical conditions are linked to the stroke risk, which may a previous stroke or TIA, high BP, high cholesterol, heart disease such as coronary artery disease, heart valve defects, enlarged heart chambers and irregular heartbeats, sickle cell disease, and diabetes. Let's see the diagnosis. Your doctor will ask you, or a family member will ask about your symptom and what are you doing when they arise. They'll take your medical history to check out the stroke risk factors. They also ask what about your medications to check your BP and listen to your heart sound. You will also have a physical examination during the doctors evaluate the balance, coordination, weakness, numbness, signs of confusion and vision issues. Also, let's see the test to diagnose the strokes. Blood test. Your doctor may draw blood from your body and determine your blood sugar level, if you have any infection, your platelet levels and how fast your blood clots through MRI and CT scan. You may undergo either both or a magnetic resonance imaging and computerized topography. The MRI will help you to see if any brain tissue or brain cells have been damaged. A CT can provide a detailed and clear picture of your brain that shows the bleeding or damage in the brain. EKG. Your doctor may order an electrocardiogram EKG too. This simple test records the electrical activity in the heart, measuring the rhythm and recording how fast it beats. Cerebellar angiogram. Another test for the circulation of blood in the brain. Carotid ultrasound. A carotid ultrasound, also known as carotid duplex scan, shows the fatty deposits in your carotid arteries which supply the blood to your face, neck and brain. It can also show whether your carotid arteries have been narrowed or blocked. Echocardiogram. Stroke treatment. Type of stroke depends on type of the treatment also. For ischemic and TIA, antiplatelet and anticoagulants, clot breaking drugs, mechanical thrombectomy, stents and surgery are the main medications. In hemorrhagic stroke, medications which are likely to be more prescribed the drugs which can reduce the blood pressure, lower the pressure in your blood and the brain, prevent seizures, prevent blood vessel constriction. Coiling. This procedure is your doctor guides you a long tube to the area of hemorrhage or weakened blood vessel. Then they install a coil-like device in the area where the artery wall is weak. This blocks the blood flow to the area, reduces the bleeding. Clamping. During image testing, your doctor may discover an aneurysm that hasn't started bleeding yet, has also stopped. To prevent the additional bleeding, a surgeon may place a surgery with a tiny clamp at the base of the aneurysm. This cuts off the blood supply and prevents the possible broken blood vessel or new bleeding. Surgery. If your doctor sees that an aneurysm has burst, they may undergo the surgery to clip the aneurysm and prevent the additional bleeding. Stroke medications. These are several medications are used to treat the stroke. The type of your doctor prescribes depends on the type of the stroke you had. The goal of some medication is to prevent the second stroke, while the others to prevent the stroke happening from the first place even. The common medication strokes are tissue plasmogen activator TPA, anticoagulants which are warfarin, antiplatelets which includes the aspirin and clopidogrel which is known as Palvex, and Zocor, Lipitor, Crestor. Blood pressure drugs. High blood pressure can cause the piece of plaque build up in your heart to break up, which leads to the resultant heavy stroke. Recovering from a stroke. Stroke is the leading cause of the long-term disability in the United States as well as in other countries. However, the national stroke accepts 10% of the survivors, while the 25 others only have the minor impairments. There are several therapy, which is speech therapy, cognitive therapy, relearning the memory skills, and physical therapy, which helps to rehabilitation in the clinic and causes the minimum occurrence of the stroke in your body. Thank you.